Welcome, everyone. Welcome to Learning and Teaching Systemic Therapy, the official Society for the Teaching of Marriage and Family Therapy, STMFT in short, podcast. I'm your host, Dr. Sofia Georgiadou. I created STMFT in this podcast as an antidote to the isolation I experienced as an early career academic. I also created STMFT in this podcast as a space to allow myself and my colleagues to share resources and bridge the way we do systemic therapy with the way we teach systemic therapy in our classrooms. Today's episode is especially exciting to me for many reasons. I'm honored to welcome a fellow Australian-based MFT educator and colleague, Dr. Leonie White. She's a clinical family therapist and psychologist with almost 30 years experience. She works in private practice and as a director of Phoenix Family Therapy Academy. She has spent more than a decade in AAFT-accredited family therapy training programs. She has taught, trained, and supervised across multiple university programs. She brings a practical, integrative, and attachment and neuroscience-informed systemic lens to support both emerging and experienced practitioners with teaching that reflects a deep commitment to adult learning and experiential approaches. Leonie offers a broad range of professional development initiatives across Australia and New Zealand, including foundational, advanced, trauma-informed, and systemic family therapy workshops. She also provides individual and group supervision, mentorship, and consultancy to mental health, education, and child protection professionals. Leonie has presented at national and international conferences, including keynote addresses. She has contributed to the field through academic publication as a guest editor for a special issue of the Australian and New Zealand Journal of Family Therapy on integrative practice, and she's currently working on a special issue of the same journal on teaching family therapy in Australia. How exciting! We're thrilled to have you here today. Welcome, Leonie.
Thank you, Sophia. I'm really thrilled to be here as well and to be able to have a conversation with you about teaching and learning in systemic therapy.
Lovely. And so before we start, would you like to share a little bit about the land that you're filming from today?
Yeah, thank you. I really wanted to start with an acknowledgement of country, which is something that we do in Australia to show respect. And so before we start, I wanted to acknowledge that I'm recording this podcast on the ancestral lands of the Yugambeh people. And I acknowledge the first Australians as the traditional custodians of this continent, whose cultures are among the oldest living cultures in human history. I pay my respects to their elders, past, present, and emerging, for they hold the memories, the traditions, the culture, and the hopes of Aboriginal and Torres Strait peoples across the nation.
Lovely. Thank you for that. Without further ado, I want to dive into our first question
Yeah, please.
today. So, in your training courses and certificate programs, and there's a huge variety of those on your website, you center a multi-positioned integrative stance in systemic practice. I would love for you to walk us through your approach and what teaching methods you use to train clinicians in an integrative perspective.
Yeah, absolutely. So before we dive into the approach, just a couple of things to consider to set up the conversation. And the first is that if we're having a multi-positioned integrative stance, then that's got to rest on a foundation of systems thinking, the key. And so for me, that means whether I'm working or teaching, it all starts with systems thinking. And I do also want to note, in terms of decolonizing therapy, systems thinking isn't new. So I love the work and the influence, for example, of Bateson and all of the people from that era in time. But I also want to acknowledge that First Nations people have always known about the interconnection of all things. Thinking about systems theory also means, for me, thinking about the classic approaches to systemic family therapy, not just thinking about what's contemporary practice. And it means as well not being like pick and mix eclectic around what you're doing when you're being integrative, but being selective and being informed by systemic principles to give a sense of coherence and a really thoughtful, intentional process. So that said, the approach, I can give like a brief overview, and this comes from an article published with my colleague Kate Owen in 2022, looking at the systemic metaframe. But also it's been a couple years and I've been teaching this a lot and practicing and have some kind of, I guess, like updated ideas as well. So I just run you through that. but also for your listeners, just so that they're aware, this is actually free to read, this article, actually the whole special issue on the website for the Australian and New Zealand Journal of Family Therapy.
We can link this in the show notes for people to access.
Fantastic.
Yeah.
There's a whole range of really great contributions from different people who have different ways of thinking about integrative practice. So I think it would be really interesting for people. My thinking about integrative practice really started years ago when I was working in a complex child and youth mental health service, looking at supporting young people in out-of-home care who'd experienced complex trauma and a range of issues, not just in terms of what they were managing, but systemic issues with the different stakeholders involved. And so I realized at that time that I really had to do more than one thing in order to be helpful and meet the need. And then that got me thinking, how do I do that in a structured, organized way? And then how can I help others do that? And so this meta framework that Kate and I talk about in the article, it's like a process map for thinking and decision making, not a prescription of what type of therapy. So it's not do this therapy, then do this therapy. It's more, here's a way to think about your client's particular individual circumstances and needs, and then collaborate with them on what might be helpful. So it's like a bubble of relationship with systemic thinking inside it. And the first kind of outer layer of the bubble that really sets everything up well to do systemic thinking and practice in an integrative way. We've drawn on the way of being meta model from the authors Fife et al. And just in a nutshell, this is so beautiful. It's about the human